Monsieur Wave.
Yo, apply. Yo, luta do dede. Luta mo nulo jël moto nga andil ma xaalis. Hello?
Bësal mu fine.
What?
Bësal mu fine.
Oh, yes!
Wave acts in Gambia. Deposit and withdraw money, pay bills and buy mobile credit without fees. Transfer money wherever in the country for only 1% fee. Ak Wave, bësal mu fine. Wave, your money is yours.
Jar Oil. The company have filling stations across the country, and our rates are relatively cheaper than anyone else across the country. Jar Oil is the biggest producer and distributor of cement in the country with the most competitive prices in the market.
In the Gambia, we all move to different paces. Time is money, convenience is power, and now both are in your hands. No more long lines, no more late payments, no more missed chances, not anymore. Because now the Gambia has its own super app, Zap. One app, one tap, endless convenience. Send money instantly, pay your bills in seconds, shop without borders, pay your rides, order your meal, buy your ticket, deposit and withdraw money for absolutely free. No extra charges, no hidden fees, only on Zap Super App. This is not just convenience. This is confidence. This is the future in your hands. And the best part, Zap is born right here. Built for us, designed for every Gambian home, every Gambian dream. So don't wait in the past. Step into the future. Download Zap today on App Store and Play Store and enjoy endless free services. Call us today on our toll-free number 1666 or on 260-0001. Zap. All in one. All for you. Tap in. Zap in.
Now, as the Gambia continues to navigate the challenges of a fragile healthcare system, organizations like Children's Surgery International are stepping in with bold community-driven solutions. CSI, as it's known for short, is launching a major medical mission at the Edward Francis Small Teaching Hospital tomorrow, offering free surgical and medical services, especially for children. We are privileged this morning to have two guests to talk to us about the charitable organization that is. Lady and gentlemen, welcome and thanks for coming to Coffee Time. Kindly introduce yourselves, starting with the lady, please.
Thank you for including me. My name is Dr. Karen Resch. I'm a pediatric emergency medicine physician from the United States and grateful to be back for my second medical trip to the Gambia.
I am Abdou Manjang. I'm from Impact Health, the Gambia. I am a born and raised Gambian and now live in the U.S. in Minneapolis, Minnesota.
Once again, thank you for coming. Can you start by telling us about the mission and history of Children's Surgery International?
I'd be happy to. We are a nonprofit organization, which means we are run primarily on volunteers. We have a few paid office staff to help us facilitate the logistics of our work. All of the medical team is volunteer. We have jobs outside of what we do here, but we take time off to come here to provide our services, medical equipment, teaching, collaborate with local Gambian medical professionals to try and advance pediatric care in the Gambia.
So how does CIS choose its mission locations, and what made the Gambia a priority?
We choose countries that we feel could use our help as far as teaching and willing to collaborate with us. So not only do we perform surgeries and medical care, but we provide teaching to the local communities, physicians, nursing, everybody involved in patient care. And we felt the Gambia was a welcoming country for that service, as well as we felt we had something to offer to the people here, as well as we could learn from our fellow Gambians. So it's a collaborative relationship that we try to facilitate.
Abdou, do tell us more about your organization.
Yes, Impact Health the Gambia was founded back in 2022, rooted in having a childhood trauma experiencing the lack of resources when it comes to delivering quality healthcare services in the Gambia here. That passion led me to, found a nonprofit organization that could support the government's effort in complementing the high-quality healthcare services. So when I was a child growing up, I was bitten by a dog. I couldn't get a rabies shot in the whole entire country, even though financially we had that money available but couldn't have it. And we founded this organization to work hand in gloves to help our providers in the country here. So we supply medical supply, we donate medical supplies, and also do capacity building, training our professionals here, collaborating with partners like CSI to complement that effort. So it's volunteer work. We don't get paid out of it. We don't get a penny out of it. And sometimes we even have to dig in our own pockets to support our work in the Gambia.
So what made you decide to, partner with, like you said, stakeholders like CSI, and what are the impacts you're hoping to gain from a partnership like that?
That's a great question. CSI reached out to me. They reached out to our organization. We didn't reach out to them. So that's a manifestation, their desire to come to the Gambia and support the healthcare professionals here. When they reach out and ask if we can explore possibilities to collaborate, since we are supporting the health system of the Gambia. And as a born Gambian, these are kind of the outreach that I always seek out, but they came to us. And I know we have some, knowing their expertise, the resource that they have, choosing the Gambia, they could go to Senegal. But coming to the Gambia is something that says a lot. So our partnership has been great, and we are fully committed to living up to that expectation.
Leads me to my next question to Dr. Kesh. What inspired CSI to begin working in countries like the Gambia?
Well, I think for most of us living in the United States, we feel really, really fortunate with the medical care that we are able to access. And those of us that are involved have the skills to bring with us somewhere else. We went to school for a long time, we trained, and we bring those skills with us. And we wanted to reach countries that didn't have the same access as we did in the United States, and to better facilitate teaching, learning, bring our skills to teach the medical teams in these countries that we can help, and I said learn from them as well.
This is not the first time, CSI, their first mission in the Gambia. What kind of support have you provided to the country's health sector so far?
Good question. This is our second trip, which starts tomorrow. Last year I was fortunate enough to be along. We performed, I think, close to 40 or more life-changing surgeries for children that didn't have access that they needed because of long waiting lists, so we were able to provide that. We provided training for physicians, nursing staff, everybody involved in their care. So when we left, the kids were in good hands to continue being cared for. We provided medical equipment, we provided feeding bottles, a lot of things that we brought with us, resources we leave here in the country. We also do our best to buy the resources we need to do our mission, such as medicines in country, the best we can to support the economy when we're here. So those are the big things, I think, is trying to change it one child at a time and leave a legacy for.
Abdou, you told us about your experience when growing up with the dog bite and all of that. So are there, underlying health issues that you have prioritized or given advice as far as your collaboration with CSI is concerned for them to deal with during, their mission here right now?
Yeah, I think I'm a consultant by background. When it comes to, I focus on quality and access, high quality and access in healthcare delivery services. So with CSI, Impact Health the Gambia focus is establish that partnership that's long-term, sustainable as well. That's why we have the Gambian Embassy, the Foreign Ministry, and Medicine Control and Children's and Child Welfare in our partnership with CSI to help with the logistics. But from our organization standpoint, it's more of how can we have those tangible results. from the quality and patient safety perspective. CSI delivering the services is just not clearing the backlog of cases that are potentially in the health system here, because we know the need is very high with limited resources. But how can we sustain it, measure it? Because we have a saying in the process improvement concept, if you can't measure it, you cannot sustain it. So that sustainability comes in. Our lens is looking at the quality of services, what are the metrics that we can look at, what are the impacts that are tangible when it comes to the work that CSI, the incredible work that they're doing in the Gambia.
What specific medical conditions are you addressing during this mission, and how are they impacting Gambian children?
So for this trip is general surgery and urology. So we know that's a big need in here. I can't tell you how many people have reached out to me personally, and on Facebook as well, when we posted about the coming of CSI to the Gambia. So the need is high, and we will do what we can, like Dr. Resch says, is about changing the life of one child at a time.
Now, Dr. Kesh, how do you ensure continuity of care for patients after your team leaves?
We do our best to train the team or work with the team while we're here to provide ongoing care. We also provide education through Zoom meetings. We can provide both meetings or didactic handouts should people desire that, and we've done that in other countries in Africa, especially during COVID when we couldn't travel. We pivoted to do more online teaching. So we'll continue that type of outreach even though we're not in country, and we are always available should a need arise for a specific medical device, feeding device. We have done that in other places. We've got the children the things they need to sustain their growth and improvement.
Okay. Aside from the partnership with Mr. Manjang, what other government ministries or agencies have you worked with in planning and executing this mission?
Other than those in the Gambia, I think
so when they came in November, there wasn't any formal high-level engagement, and from the Gambia, I know if you want successful and sustainable initiative, not just here, but in healthcare in general, is a collective work. When I was doing my master's program, I often tell my colleagues, healthcare is a collective work. You bring your part, I bring my part, someone else bring his part in the game. That's a combination of that give that result, that outcome that we want. So we have been grateful for this trip to get a higher level engagement. The embassy, the Gambian embassy in Washington, D.C., to the Minister of Health and Minister of Foreign Affairs.
So how important is cross-sector collaboration between health, education, and social welfare in making your work successful?
Yeah, so that's a great question. I think the evidence of that is this trip. We have worked with the embassy from A to Z because of that engagement, that collaboration. Our travel into the Gambia was very easy. Logistics were catered at a timely fashion. So that shows when you have everyone working simultaneously, the outcome is always great.
Yeah, I mean, the CSI is known for building strong partnerships. So who are your key collaborators on this mission?
Here, the Gambian embassy in Washington, D.C. We have been working closely with the secretary, Sekou Cisse, the ambassador himself, His Excellency Ba, and the deputy chief of mission, Yankuba Drame, former CDS. So these folks have been very helpful, and through their outreach, we were able to connect with Dr. Nyasi, Permanent Secretary Damfa, and Dr. Samate and Dr. Vite as well. And that collaboration spread to the direct patient care staff, the clinicians, Dr. Jallo, Mr. Omar, and their entire team.
Dr. Kesh, you talked about training other practitioners to maintain continuity. So how do you plan to work with local medical professionals to ensure skills transfer and long-term impact?
We welcome anybody that wants to learn from us. So Our surgeons will work side by side with the Gambian surgeons. Our anesthesiology team will work side by side with anesthesiology from the Gambians. Our nurses will work with the Gambian nurses to provide aftercare for our families and children when we're gone. So it really is a collaborative effort. They are at the bedside. We are communicating together, learning from each other, and I think that's the best way to progress with the medical education, is to actually be at the bedside learning from each other.
What role does Impact Health, the Gambia, play in facilitating your work here?
Yeah, so when CSI reached out, and before I even answer that question, if I may add on to Dr. Resch's response, I think that capacity building is a way of, teaching someone how to fish rather than providing fish to the person. So for us, we working with them, making sure that we not only make the experience seamless, but also sustainable. And, giving that visibility to the great work that they're doing, but also see where the needs are, how can we support them in that lens, and also find a way to sustain that collaboration.
What are your immediate goals for this current?
For me, it's more of, this is our first time coming with CSI. So our role is, how can we make this experience positive? Because I am confident if that continues, we will have CSI presence here like they are in other countries. In Liberia, for instance, over 10 years. In Ethiopia, over 25 years. So the Gambia, choosing the Gambia, I want them to go more than those, those countries, because, always feel jealous when you see good things happen in other places. So that's our mission, and that's our, that's what we're yielding towards.
So what type of medical supplies and services has the IHTG provided to public hospitals so far?
Good. Few years ago, when we started this journey, we donated some medical supplies to Bundung Child and Maternal Hospitals, Edward Francis Hospital, and also Canifin General Hospital, and we gave some supplies to the Gambia Armed Forces as well. This trip, we brought equipment from one of our partners called Mega Solutions Foundations. They gave us incredible equipment, vital signs monitors, scales, baby scales, wheels on monitors to do telehealth care, and they also gave us exam tables, you name it, so many of them. And yesterday I was in Badibu Mandori and Salikenye. We gave some supplies to those villages. And we have some in our stack as well to donate to Edward Francis Teaching Hospital, Bundung Maternal and Child Hospitals, and Canifin General Hospitals. So we supply hospitals with equipment. Another partner gave us PPE, that's personal protective equipment, like gloves, masks, and other things for donations as well. That's one of our key focus, but also we do quality and patient safety consultation, which is my background again. And the third component is this capacity building. How can we utilize people in the best manner for them to be equipped well enough to enhance their skills, refine and retune to support the care delivery that they want.
How does the IHCG's U.S. registration and international base influence its operation here in the Gambia? Yeah,
so we are a registered nonprofit organization. We are registered with Internal Revenue Services, that IRS. We have 501c3 tax-exempt status. And another part of it, we are registered nonprofit with the Minnesota Secretary of State Office, and also part of the Minnesota Nonprofit Organization. So this registration gave us the credibility to operate and support our global health mission, because without them, we won't be able to do the work that we're doing.
Can you share a defining moment or milestone that shaped the organization's mission?
Partnership with CSI, I would say that, because I reach out to so many organizations. We have partners with some of our faculties at the University of Minnesota Medical School. In fact, we had a plan to come in October, because being the Breast Cancer Awareness Month. However, when CSI jumped in and requested if we can partner for this trip, it was our, our green light. That's our highlight. Since our inception in 2022 to today, I would say the partnership with CSI is the most outstanding achievement that we have achieved so far. And I can't wait to see that collaboration yield results, because, as I said, as a I was a child here who went through the healthcare system, seeing the single impact in each child that we touch. I can go back and sleep and say, I'm able to make a difference in the lives of many children in the Gambia.
Dr. Kesh, looking ahead, how does the CSI plan to deepen its engagement with the Gambia's health system?
Well, my hope is that we can continue to grow our relationship with the providers here, also working with the Impact Gambia, to come back on an annual basis. And I think one of the unique things with CSI is we're not a one-and-done shop. We care about these kids. We care about the people of the community. Some of the surgeries we do are necessary to have subsequent surgeries. For example, we've gone to Mexico now for 25 years, and we've seen children grow from infancy to teenage years and need surgeries along the way every couple of years based on what their needs are. If we're fixing a cleft lip or palate, or, for example, intestinal obstruction, that's not a one and done. We see these kids through all of their surgeries. So that's really unique to CSI. We care about the kids from when we start to when we are done. And that might not just be a one mission trip. Consistency and continuity. Right.
Dr. Manjang, what types of medical supplies, and rather, let's deal with health issues now, because mental health and addiction services are part of your focus, yes?
Yes.
How are you addressing these often overlooked areas?
Yes. Maybe a quick correction here. I'm not a doctor. I work with a lot of doctors. You are not the only one to miss that, because a few months ago I was in India giving a speech at a conference. They gave me the title doctor.
Well,
so I am not yet.
Maybe it's the title coming.
Yes, could be. So, yes, mental health, when we originally started our initiative, mental health was our key focus, because at the time in the Gambia, Kush was very popular, substance abuse. And the way we treat mentally ill folks in the Gambia, the negative perception attached to it is really difficult for people to accept their struggles. So that was our focus. But later on we pivot, knowing that we just can't focus on one area, because I ended up working at the University of Minnesota Medical School, which allowed me to partner with various professionals in oncology, in surgery as well, in anesthesia. So we pivot to more of a broader capacity building training rather than in just one focus. But the Gambian Association in Minnesota and Impact Health the Gambia and the Gambian Nurses Association in Minnesota collaborated to support some of our healthcare initiatives in the Gambia here, particularly mental health illnesses. So we meet quarterly to discuss how we can support. And a few months ago, I will say we did a fundraising, and we raised about $400 or so, and bought some feminine hygiene supplies for our tanka folks. And we are going to deliver those supplies sometime next week for them. So, that's one area of supporting our mental health institution in this country.
How do you measure the impact of your interventions on patient care and health outcomes?
So we go with quality improvement concept, lean concept, looking at things that are waste, non-value added in the process, weed them out and refine, redesign the new process. How do we think it's going to work well? And if during that process we do something called PDSA, Plan, Do, Study, Act, basically an experimentation, and see the outcome of that experimentation. If it is great, you sustain it. If it is not good, redefine it or abandon it and try something else. And that's the concept that we want to implement in the care delivery model here in the Gambia, working with our clinicians. Not the way that we used to do things or how we do it, but constantly looking at how can we make the process better. It is good, but how can we be better at it?
So what challenges would you say you have faced in coordinating across sectors like health, education, and social welfare?
Operating from a distance, obviously, time difference is there. Getting responses on time, on both ends, that's a challenge. But how we address it is the key, right? We know if you want to have a sustainable global health initiative, you need to have folks on the ground who can be your set of eyes, who can give you some insights. The good thing is we have that. We have no concern. We have one of the most reliable partner, Mr. Babukar Sen at Kanifing General Hospital. He's the administrative head there. Since him and I have known each other for over 10 years, and our connection even started debating about the healthcare system in the Gambia. So he's been very helpful. Having him on the ground has been great, and that's how we navigate it instead of doing it without anyone on the ground to give us some insights.
So how does, IHTG navigate policy alignment and regulatory frameworks in its work with public?
The approach that we have taken is working with the Gambian Embassy in Washington, D.C. I left the Gambia when I was early 19, right after high school. I left to the U.S. for further studies. So I am not that familiar with various policies, even though I'm constantly following Gambian activities, everything. But knowing the embassy stands for the interests of the country and represent that country's citizens. I collaborate. I made an outreach to the Gambian embassy through the deputy head of mission, Yankuba Drame, General Yankuba Drame. So through this partnership, is the only way that we can navigate some of these challenges. For example, MCA, the Medicine Control Agency, CSI come and bring in medication. How can we make sure we get clearance? We bring in they look at the right medications coming in. Through the engagement with the embassy, we are able to have that facilitation. So,
other than the CSI, who are your, if any, other international partners, and what roles do they have in playing or funding logistics and technical support? Any international partners?
No international partner as of now, but we do have some faculties at the University of Minnesota to partner with us, and they have expressed desire, like 5 different faculties. One was my former manager, who's an internal medicine, critical care medicine. Our potential area of exploring are oncology, breast cancer. That's a strong passion for me. We want, our ladies in the Gambia, our mothers and sisters, know how to do those examination. That's one piece. Another piece is anesthesiology. We know in the Gambia some of those high powerful medication to help when people go in anesthesia, how to be comfortable but also come out of anesthesia safely. That's one piece. As I checked last time, we only have one anesthesiologist, a Gambian. So when I always say this, UTG, when they're doing their annual graduation, you have thousands of people graduating in business administration, law, but we have fewer medical staff. So that's one thing that we can support.
Yes. So how do you plan to scale your training and support efforts in the near term?
It's again that partnership. Like, I love the approach of CSI. We work elbow to elbow with the clinicians that we are in the OR with, in the operating rooms with, give them the skills, show them how we do things, but also CSI partners or our international partners, learning from our locals. How do you navigate, in a low resource setting? Like, a provider, a surgeon in the U.S. can work efficiently, quicker, and effectively because every tool he needs or she needs is available, right? Day before surgery, they do what they call preference card, case check. You got everything that you need. in the Gambia, some of those supplies are not here, some of those equipment are not here, so you have to navigate how do you effectively and safely operate without jeopardizing the patient life. So our partners also learn that, how do I operate here? So it's about vice versa.
Are there any upcoming programs or pilot initiatives we should watch out for?
Yeah, we will have a screening before our patients go into the operating room. Our doctors will do the screening, and some of our surgeons as well to give the green light. Says yes, we can help this kid, and also the donation that we are going to deliver to Edward Francis. That's another piece. I'm excited for that because the Gambian community came big to support that initiative with the collaboration with the Gambian nurses and the Gambian Association. Another piece is the excitement of meeting with some of our partners here in the government sector to support our work. Have that rapport, that one-on-one engagement, better than emailing. So since we're in the country, this is an opportunity to get off from Zoom and meet them in person, have that meet one-on-one greeting and chit-chatting to see how we can explore this opportunity. So there are more coming. We have another partner who's an anesthesiologist. He currently supports the healthcare system in Sierra Leone. We want him to come to the Gambia as well. So that's in the works. We have started the discussion, and I'm looking forward to that.
That leads me to my next question. Are there plans to expand partnerships with regional or global health networks?
Absolutely. That's our love one. Our area of we are looking into this particular provider, doctor that I said at Columbia University in New York. He operates in Sierra Leone, and he suggested maybe we can go within ECOWAS, how we can support other countries. Gambia is not in isolation when it comes to scarcity of resources in the healthcare field. Pretty much is everywhere in Africa. So I cannot tell. My mom is from Guinea-Conakry, and her relatives often request expanding our services to Guinea. Like yesterday when we went to Manduri, my mom's sister was with us. She asked me, how can we help their community to have vital signs monitors? She even asked for one vital signs monitor. So that says the need is everywhere. So, but it's about one step at a time and assessed.
Indeed. How do you ensure that external support aligns with local needs and priorities?
Yeah, the external support, it's all about need assessment. Not just sending things or assuming this is what this community or this healthcare system need, but ask the local, what are your challenges? How can we help you? Hear from them to give you the direction and express their need, and then work with them on that. That's the best approach, and that's what I utilize, rather than spending resources and time and energy into something that will not be that helpful or not needed at the time. But when you conduct your need assessment, you definitely know what exactly your partners are requesting.
Dr. Kesh, do you envision a future where Gambian hospitals can independently perform the surgeries your team currently provides?
Absolutely. That is our ultimate goal. And my first trip with CSI was over 20 years ago to Ghana. And that is exactly what happened in the country of Ghana, training their ENT surgeons. I think it took us 3 years to share and be collaborative with our skill set and teach them how to successfully do what they needed to do for pediatrics. And we no longer go to Ghana. And that is our ultimate goal, is to teach ourselves out of our volunteer work.
You've told us success stories about, your time in Mexico, and this is your second time in the Gambia. Are there any success stories here in the Gambia you can tell us about?
Oh, absolutely. I loved the patients I met last year. I'm still in touch with one family through WhatsApp, and it just brings me joy to see pictures of this little girl growing up. We removed a tumor that she was born with between her eyes at the top of her nose there. We had to work to get a scan because 1 out of 10 times that contains brain tissue, and we didn't want to enter her brain. Luckily, she was 9 out of 10, and we could take it off. She is thriving. The scar is healing well. That brings me joy.
Any continuity, patient care, victims or patients you have that, are out there that you can tell us about? Like,
the first year I don't recall any surgeries that we did that need ongoing surgeries. And that was the goal of the first year.
Not so many of those here.
Right. But this year there probably will be some children that need ongoing surgeries after we perform the surgery this year. So the first year we picked our patients that we could do a one and done, and we could fix their problem, hopefully, or whatever medical need they had. But going forward, as we get this collaborative off the ground and we're more comfortable with our colleagues here, we are choosing more complicated patients that will need perhaps another surgery next year as they grow. So I think we're able to do more complicated things as the teaching increases, as we get comfortable working with each other. So I don't have a lot of ongoing needs kids from last year, but I think that will change going forward as our partnership grows.
In your expertise and experience, what would you say are, the most needed surgeries that you've had to do while you are on mission in the Gambia?
So far, I think it's urology. There are a lot of need for malformations that babies are born with that need ongoing surgeries. Again, it's not just a one-time surgery. They need a surgery to stabilize their intestinal tract or their GU tract, and as they grow, they need a subsequent surgery. And then just a lot of general surgeries, whether it's hernias, tumors that need to be taken off.
When you say hernia, someone like me is wondering, what is that?
A hernia? Good question. It's a pouching of the abdominal muscle where an organ can come into there, whether it's an intestine that comes in or a testicle that slides up and down because there's a hole in your muscle. So my surgeons go in and they fix that hole so the organ can't slide back and forth. It stays where it needs to stay. And that's just something people are born with.
And this priority is given to children, or have you had experiences with the elderly population?
We do just pediatrics. All of my team that's in the air now all work at pediatric facilities. So we just do children up to about 21.
So finally, what would you two have to say to the Gambian public, about, tomorrow's program?
Well, I will say CSI is here. Last time they came, that not a lot of folks in the, not much of a public awareness. And I would like us to, give them that attention. The incredible work that they're doing needs to be recognized, but also be celebrated, because like the story of Isa to the little girl, as she said, it moved me. And all my interactions with our government officials and our healthcare professionals here, I remind them about this kid because I see myself in that kid's situation. And I always say, there are so many Aisatu and so many Abdou of mine that are in the Gambia. But I will, I'm looking forward to it. And also our event, I will say, families to come is about, see how we can help. We can't help everyone, but we will help as many as we can, because the kids in this country need the services. And likewise, the providers here, they can do it all by themselves. So if you have a group coming in, flew from the U.S. to here, I went for 3 days, only slept for 2 hours. So it's about seeing that impact. And the other part that I will say is the tangible result that will come out of this trip. I came here, this is my 4th trip coming to the Gambia, but this is the outstanding one that I could, beat my chest and say, yes, tell my kids, Daddy was part of an incredible work, like my daughter always says, you helping the kids in the Gambia. That's grateful.
Mr. Manjang, thank you very much, and thank you, Dr. Kesh. Once again, I was talking there to pediatrician Dr. Karen Resch and, of course, Abdou Manjang of the U.S.-based charitable organization Children's Surgery International. And live on West Coast Radio, I am Aji Jogapkan.
mu si Wave.
Yow Ablaye, yow lu tax doo dee dégg lu tax mënuloo jël moto nga andil ma xaalis. Hello? Ana lay waxal.
Bësal mu fine.
What?
Bësal mu fine.
Oh, yes!
Wave in Gambia. Deposit and withdraw money, pay bills and buy mobile credit without fees. Transfer money wherever in the country for only 1% fee. At Wave, Bësal mu fine. Wave, your money is yours.
Jar Oil, the company, have filling stations across the country, and our rates are relatively cheaper than anyone else across the country. Jar Oil is the biggest producer and distributor of cement in the country with the most competitive prices in the market.
In the Gambia, we all move to different paces. Time is money, convenience is power, and now both are in your hands. No more long lines, no more late payments, no more missed chances, not anymore. Because now the Gambia has its own super app, Zap. One app, one tap, endless convenience. Send money instantly, pay your bills in seconds, shop without borders, pay your rides, order your meal, buy your ticket, deposit and withdraw money for absolutely free. No extra charges, no hidden fees, only on Zap Super App. This is not just convenience. This is confidence. This is the future in your hands. And the best part, Zap is born right here. Built for us, designed for every Gambian home, every Gambian dream. So don't wait in the past. Step into the future. Download Zap today on App Store and Play Store and enjoy endless free services. Call us today on our toll-free number 1666 or on 260-0001. Zap. All in one. All for you. Tap in. Zap in.